Looking for a TheraNest alternative usually starts the moment a therapy practice grows into IOP, PHP, or residential, and the EHR can't keep up. When a practice expands beyond outpatient therapy, an EHR built for solo clinicians can become the thing holding the whole organization back. TheraNest versus Behave Health, a side-by-side look at admissions, clinical documentation, billing, and operations for behavioral health organizations. We compare both platforms across the CRM, EHR, RCM, and operational tools a growing behavioral health organization actually relies on. Based on publicly available information, TheraNest appears to focus on solo clinicians and group therapy practices, delivering outpatient one-on-one and small group care. Its feature set emphasizes scheduling, clinical notes, telehealth, and basic billing for practices operating as professional offices. Behave Health is an all-in-one platform purpose-built for facility-based behavioral health and addiction treatment across the full continuum of care. Choosing the wrong EHR means months of migration, staff retraining, and potential revenue disruption. And for a growing program, a facility billing gap becomes a revenue blocker. When a group practice grows into facility-based services and the platform doesn't support UB04 claims, that gap can become a revenue blocker. The EHR touches everything from the first inquiry call through clinical documentation, billing, and alumni follow-up, so a poor fit is felt everywhere. Behave Health is designed to support the full continuum of care, without a second platform for facility-based programs, and without forcing a group practice to outgrow its EHR as it scales. It serves treatment centers, recovery residences, sober living, RCOs, peer support, drug courts, and NARA affiliates in one system. ASAM assessments and withdrawal scoring are built into the documentation flow rather than treated as add-ons. 4 areas decide whether a platform fits a growing behavioral health organization. Let us walk through all 4. Admissions and lead management, clinical documentation, revenue cycle, and back-office operations. Compare each before you migrate. Area 1. Admissions, the revenue engine of any behavioral health organization. A dedicated admissions CRM with lead tracking, referral analytics, bed availability, and online applications does not appear to be a primary emphasis of TheraNest. Behave Health's CRM is built around speed to admission, with online applications, instant verification of benefits, referral tracking, and census management. Area 2. Clinical documentation, the core of any behavioral health EHR. TheraNest appears to offer outpatient therapy workflows marketed for solo and small group therapy practices. Behave Health is built for ASAM assessments, COWS and CWA scoring, attendance-tracked group notes, and multi-provider collaborative records. Area 3. Billing, which can make or break a program that depends on facility claims and utilization review. Facility-based billing like UB04 submission and utilization review documentation does not appear to be a primary focus of TheraNest. Behave Health integrates billing into the clinical workflow with eligibility verification, CMS 1500 and UB04 claims, ERA EOB processing, and denial management. Area 4. The operational work that happens outside the clinical record, where the biggest difference may live. Most EHR platforms, including TheraNest, based on publicly available information, do not appear to include facility operations tools. Behave Health includes property management, HR and credentialing, vehicle tracking, and maintenance scheduling alongside clinical and financial workflows. When the treatment plan, utilization review, and claim all reference the same patient data, the risk of documentation gaps that lead to denials drops significantly. A patient record created during the admissions inquiry flows directly into clinical documentation and billing without duplicate data entry. Behave Health is designed to handle prescribing, inventory, and administration within the same platform, which can reduce reliance on a separate EMR system. It is designed to support customer Part 2-oriented workflows directly, with HIPAA-aligned audit trails for SUD records. Current TheraNest users who switch get a structured migration path, so the transition does not disrupt operations or the revenue cycle. The team handles data migration, staff training, and parallel go-live support, so the switch does not interrupt your operations or revenue cycle. Behave Health puts clinical documentation, admissions, billing, operations, and alumni tracking in one platform, without managing multiple disconnected systems. The CRM, EHR, RCM, and ERP live in a single system designed to support the full continuum of care. It is purpose-built for residential, IOP, PHP, detox, and recovery housing, rather than retrofitted from an outpatient therapy tool. Behave Health offers live walkthroughs tailored to your facility type and size, covering admissions, documentation, billing, and operations end to end. Stop outgrowing your outpatient EHR as you scale. Book a 20-minute demo of the all-in-one platform at behavehealth.com. See how admissions, clinical documentation, facility billing, and operations work in one platform at behavehealth.com.